I'll put a quick one out. On your chart of impact there, you got a baseline, so nothing going on there. September was also at 0. I guess that's when you kicked it off, and then October a good spike, November a spike, but then after that it was flatlining. Do you think you might have the Hawthorne effect going on there, in that it's all couched into what could be a hand raiser impact, or
what Hawthorne? Could be a what impact?
It could either be the hand raiser impact or the Hawthorne impact. I'm curious as to why you're getting an immediate, impact October, November, but thereafter I'm sure your program is still going out, but there's nothing more happening.
Right. Well, that's a good question. I think I guess our view is that the durability of the change suggests that it wasn't something that was of a temporary phenomena. In terms of why did it not continue to rise, why did it not go from 75% to 100%, I think there's a number of reasons for that. I think that in some cases there may be medicines that the PCP thinks the patient should be taking, but that the patient doesn't want to take. Certain depression medicines potentially. If you take asthma medicines, people who have low symptom asthma, they should be taking their asthma medicines every day, but they may not if they don't have symptoms. So, I guess at the end of the day, our view is that there is some level of non-adherence that may be hard to ever entirely solve, but that, I guess our view is we made a substantial impact on it, but absolutely did not take it to 100.
If it was the Hawthorne effect, how might you tease that out in an analysis? That's a very tough question, and I don't know is an acceptable response. It's tough.
That's a good question. I guess I've always thought that Hawthorne effects wouldn't be permanent. That a Hawthorne effect would a benefit from a Hawthorne effect would dissipate, and so. I guess we haven't put a lot of effort into that on the basis that we view the durability of the change as suggesting that some underlying behavioral changes occurred. But it's a good question.
That's a good point. The hand raiser thing, which is so closely tied, would be a permanent effect, but the Hawthorne maybe would dissipate over time.
Right.
Food for thought.
Right.
I have a quick question. Hi, Matt. It seems my question is about the intensity of how long people spend doing these things. I recently signed up for a program called trackyourhappiness.org that would send me text messages maybe 5 or 6 times a day to do experience polling, and it would ask me, what are you doing right now? Are you alone? What are you wearing? Are you happy? To try to see trends, in your own life. And I found that to be, 6 or 7 times a day was fairly intrusive, but a lot of people spend an hour with a therapist daily or weekly and are perfectly happy with that interaction. So what is how long do people spend in these experiences, and is it a challenge to keep them spending that time?
Good questions. So we almost always think in terms of 2 basic elements to the experience. A startup element where the patient is starting a new therapy or recently diagnosed with a new disease, where there are certain base skills and behaviors that they may need to address just to be able to sort of enter into that new disease management and therapy. And so those are finite. They're not intended to be used forever. Some people may use them forever, but they're finite and can be done in as little as an hour. If you sit down and go through the program for an hour, you can learn key new skills. People can spend longer, but can be done in as little as an hour. We also offer ongoing support programs, which are more relevant to more of the ongoing touches, and the frequency of ongoing touches is a function to some degree of the disease, but it's largely patient driven. How much they want to be touched, and by what channels. And I was trying to think if it's even possible for someone to get 6 touches a day. I'm not sure that would even be possible if they sort of selected every possible channel. So on average, it's a touch a week. For the ongoing support, and without a doubt, people, you get a group of people who use it steadily over time, and you get people who drop off, and that's why, among the many reasons why, we're focused on the durability of our changes, because we don't think it's realistic in any program to expect 100% of people to sort of stick with it forever. It's just not going to happen. And so we focus on get in, make an impact, and then for those people who want to stay with it, continue to support them as well.
Could you just comment on whether you find some characteristics of responders versus non-responders, and whether it's possible to screen out non-responders, whether there are criteria to do that?
Right. So the answer is, and to some degree this is something we may get smarter about over time, but the answer is I would not say we yet have a way to say you're going to respond and he's not. That we certainly have some, we can ask questions up front that indicate what state a person's in, but given that the whole point is to help them change, we've found both qualitatively and quantitatively, we've found that obviously you have the folks who were already taking their medicines, or maybe they missed some doses, and maybe they missed some other elements, and they view this as a good new resource. But we actually find that certainly our most enthusiastic users are the folks who'd really struggled, and that other things hadn't worked, and that they feel that this is sort of their bespoke solution. This speaks to them. So answer to your question is, we don't have hard and fast rules on non-responders. Certainly for the electronic channels, there's not a big reason to eliminate non-responders because the cost per user is small. For the phone channels, that gets more relevant, and that often is part of working with our pharma client on what they're already doing with who they want to provide phone support to.
I think we'll have to hold any more questions to you're around for lunch and coffee. You're still around for the rest of the day, so people can follow up with more questions.
Yes.
So thank you very much.